Are filled with family, comfort food, and plenty of temptation. But for older adults living with diabetes, this time of year can bring serious health challenges, from navigating rich holiday meals to preventing complications like heart disease, glaucoma, and kidney issues. A little planning can make a huge difference.
November is National Diabetes Awareness Month, and today we're talking about practical steps that help people stay healthy without giving up every holiday favorite. Joining us this morning is Dr. Renee Roberts with Oak Street Health. And Dr. Roberts, thanks for joining us.
Thank you for having me. Good morning.
Absolutely. The holidays coming up. Why can this season be especially challenging for older adults managing diabetes?
Yes, well, this time of year is particularly challenging for older adults with diabetes. First and foremost, because we know that Thanksgiving is a food-centric holiday. There's lots of focus on eating sweets or maybe carbohydrate-rich foods, and that can pose a lot of health challenges. I also like to remind people to think about the disruption to your daily routine, right? We might be traveling by plane or car or train and be away from home. We might forget to take our medication, forget to pack our medication, and when we're away from home, we may not have access to our regularly planned meals.
That's right.
Yep.
Well, Dr. Roberts, many people think diabetes means avoiding all the good stuff. So what are some realistic holiday trade-offs that allow people to enjoy meals without risking a spike?
Yes, well, I always like to say let's start with the veggies, right? So eating things like roasted vegetables or steamed vegetables is a healthier alternative than maybe some of the more traditional foods such as the candied yams or creamy casseroles. I also encourage patients, and not just patients, but their families as well who are supporting them during this time, to utilize fruits and herbs. So think about things like lemons, limes, oranges, or even garlic. These things have a lot of flavor and can make foods taste quite tasty without adding additional salt and sugar.
And for families with older relatives, Dr. Roberts, what's a simple way to start that conversation about healthy aging and diabetes management, especially during the holidays?
Yeah, well, I think it's always important, for family members to think about how can I best support my loved one with diabetes during this time. Please, 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 I always tell patients, don't put any extra pressure on them or force them to eat certain things. Sometimes people need to be able to step aside and, maybe eat a little bit less or not have that second piece of pumpkin pie. Support them, uplift them, but certainly, don't make them feel bad or different about themselves just because they are managing a chronic condition.
Okay, you hear that? Don't pressure me.
I'll try not to.
All right.
Well, meal planning is a huge part of diabetes control. What are a few easy planning tips that viewers can use as they head into Thanksgiving and Christmas?
Yeah, well, I think it's always a good idea to plan ahead, right? When we don't have a plan, that we get tempted to reach for something, maybe through a fast food drive-through, or grab that handful of candy or cookies to try to help substitute. So take a few minutes. You can search the internet, magazines. There's lots of healthy recipes out this time of year, and find a game plan to figure out how you're going to best navigate your food choices.
All right. And unfortunately, we're running out of time here. But Dr. Roberts, for viewers who want more support managing diabetes, what does Oak Street Health offer, and how can they connect with your team?
Yes, well, we do a great job of managing many chronic conditions, including diabetes, and we'd like to provide whole patient care. So not just utilizing healthcare practitioners such as myself, but also social workers, community health workers, and behavioral health specialists. If people are interested in learning more about Oak Street Health, please pick up the phone. You can give us a call at 855-337-0583.
Okay, oakstreethealth.com. And Dr. Renee Roberts with Oak Street Health. We appreciate the time this morning. Thanks very much.
Thank you.